What is a menstrual cup? The menstrual cup is a flexible container similar to the funnel used during your period and is an alternative to sanitary pads or tampons. Made of rubber or silicone, this product can collect period blood, unlike the tampon it absorbs. This product is not disposable and can be used for up to 12 hours depending on the amount and condition of the period, and then drain and wash it. In addition to financial savings are suitable for women environmental protection. Benefits of menstrual cups. The advantages of menstrual cups should also be noted for more cleanliness. Because if you put the cup in the vagina properly during your period, it will not be ejected at all, and unlike the sanitary pad, it will collect all the blood inside it. Bathing, sports and even swimming can also be used properly. Another positive point of using this product is to prevent vaginal dryness as well as skin allergies that develop when using sanitary pads. The use and timely washing of the cup also reduces vaginal yeast infections. Each menstrual cup can hold about 30 milliliters of liquid, which is nearly twice the amount that tampons or sanitary pads can absorb. Menstrual blood produces a bad odor when exposed to air, but these cups are impermeable to the air and therefore do not produce bad odor. The use of tampons may cause an infection called toxic shock syndrome, but because the menstrual cup collects blood and does not absorb it, it is not likely to be this type of infection. In menstrual cups, chemicals used in tampons and sanitary pads, such as bleach and dioxin, are not used. Sometimes menstrual pain is reduced using a cup. How to use and placing a cup in the vagina and how to remove it from the vagina. Wash your hands with soap and water first. It is best to wash the cup before using, then fold the head of the cup and insert it into the vagina. Once the edge of the cup enters the vagina, continue pressing it in so that the entire cup and its base are placed inside the vagina, then hold the base of the cup and rotate it a full round. If part of the cup is out of the vagina or feels it inside the vagina, i.e. either the cup is large or not well placed. How to put after multiple uses is easy for you. Tips. Bend the menstrual cup completely through the middle and hold it when the border is upwards. Place the cup in the vagina when the lip is high, such as when using a tampon. The cup should be a few centimeters below the cervix. To remove it, you need to take the index finger and thumb into the vagina, grab the base of the cup and gently pull it out. To prevent blood from leaving the inside of the cup, you must hold it vertically. After leaving the cup, empty the blood and rinse it with soap and water. Tip. Even if it's easy for you to insert a cup into your vagina, it's a little hard to get it out. You need to be sitting down and pressing the cup down to remove it from the pelvic diaphragm muscles until your hand reaches its end. Disadvantages of menstrual cup. The advantages of using a cup are much greater than its disadvantages. For some women, putting and leaving the cup in the first time may be a little complicated and create an unpleasant feeling in them. If you make a mistake in choosing the size of the cup, you will face this problem. If you are allergic to rubber, silicone, latex or plastic materials, it is best not to use a cup. Of course, most cups are not made of latex. Sometimes you have to try several tampons to find the right size for yourself. A menstrual cup may irritate your vagina and cause vaginal itching, especially if you don't clean it well. If you don't insert it properly, it may cause discomfort and pain. Menstrual cup size. If you have a long vagina, use cups with longer lengths, because if you use smaller models, you may have problems exiting. But in case of short vaginal length, be sure to use small sizes because if the cup length is longer, this product will be unusable for you. Another thing you should pay attention to when buying a cup is its volume. This is directly related to the amount of bleeding you have. So if you have heavy bleeding during your period, use high volume cups so that you don't have to change and wash a lot during the day. Other things such as natural childbirth, age, strength of the pelvic floor muscles can affect the size of your appropriate cup, and many women are forced to buy it again after buying and taking the cup because of the inappropriate size. In general, women under 30 years of age use small cups and people over 30 years of age, especially women who have had natural childbirth, use larger cups. Washing the menstrual cup. It is advisable to wash it with water after each cup, and if you are a little sensitive, you can use baby soap, gentle soap or genital washing gels to wash it. Also, after finishing your period, boil the cup in water for 5 minutes to disinfect. Caution in the use of menstrual cups. If you have protrusion of the uterus, consult your doctor, a condition in which the uterus falls on the vagina due to weakened holding muscles. Recently had gynecological surgery, childbirth or miscarriage. You've already had an infection caused by toxic shock syndrome. Use a contraceptive device, such as an IUD. You haven't had sex before, and it's important for you to protect your hymen. If you have a vaginal infection. If you are allergic to latex. Golden tips. Cups should be removed and washed every 6 to 12 hours, so it can be used safely while sleeping. Soak it before inserting into the vagina to make it easier to enter. If the cup is properly placed, you should be able to walk, run or even swim easily. Disposable cups can be used for once, but most cups can be used for a few years, 10 years. If the cup is disposable, you can use it to prevent bleeding during sex. Don't worry about not coming out of the cup doesn't get stuck inside your vagina and you can easily take it out. You can easily urinate when using a cup.